Western Spring Television, ours it is.
You made it. No kidding. Way before you knew it. No matter what school of thought say, even though the fastest and most capable sperms reach the ovum first, it is the egg that has the final say on which sperm fertilizes it. You made it, and that's the big deal. Joining this conversation is yet another proof of your triumph. Pardon my manners. First of all, introduction. Hello, my name is Temitope Ajijolaoluwa Ola. I'm not a motivational speaker, not on the set. I anchor Western Spring Television's flagship health program, Spring Clinic, where we delve into everything health and well-being so we can help you not only to feel better, but also bring you information that will help you reduce the risk of diseases, lengthen your lifespan, save you money, and benefits the environment. Our own air medic, seasoned family physician with over a decade's worth of experience under his sleeve, Dr. Ayodeji Ogungbemi, is on set, as always, to take us through today's discuss. You guessed right, we're treating the reproductive system, organs, and process today. Dr. Sir, let's get the ball rolling.
Thank you very much.
Thank you, sir. Good afternoon.
Thank you for having me.
It's a pleasure always.
I want to thank everybody for joining management. Somehow, it's a topic I've been trying to run away from.
Why? It's a topic everybody wants to know because it concerns everybody.
Exactly, and that's why I've been trying to run away from. Because reproductive system, it's a very big system, and it touches everyone. Everyone, even the boy, the girl wants to hear something. Oh, reproductive system.
Yeah.
Like that. So, well, let's get the ball rolling. And as our practices, be as simple as possible so that we can get one or two things from what we're discussing. And I really want to say I can't exhaust all the details because just like every other organ system talked about, this is an area of specialty that after graduating from medical school, somebody will spend 5 years studying this alone. Not even just this, because this talks about both the female and the male. So they spend like 5 to 6 years on the female, and then 5 to 6 years on the male. So what we are talking about today is the combination of two specialties. So we have the obstetrics and gynecology, majoring on particularly the female, and then the urologist. Urology.
Did you hear that?
Urology. Majoring on that of the male. So we'll just try to mention some key things, key points. So what's the reproductive system? What is the reproductive system? It's, just like every other system, but this time around, I like to say a very delicate and intricately connected vis-a-vis even timing, organ structures, and the physiology is very interesting because it deals with time and a lot of things can affect it. And that's why the issue of infertility remains a big topic in the world. Even despite all interventions, we have some cases where one may not really be able to have explanations. So let's look at it. The system is divided into two. You have the male reproductive system, you have the female reproductive system. So let's look at the male first. the male reproductive system, let's talk about the organs involved, or parts of it, anatomically. The very common one, we have the testes. Every male should have two. So, but there could be problems where some may have one, but it's a problem. That is, it's meant to be two. And without the testes, there's no way we can have the sperms, because the testes are produced in the sperm. No, the sperms are produced in the. Now, I mentioned intricately and delicately. I deliberately chose those words because a lot of factors can affect sperm production in a normal testis.
Okay.
You know, I mentioned that the testis could be abnormal. That's one. But let's assume it's a normal testis. Other factors could affect it. Get to those points later. But we need to know testis is important. Then we have the epididymis. I'm not sure I've heard that.
We have. I have. Have you? I have.
So the epididymis, these are like just connecting tubes here and there that will connect the testis to the various ducts. When we say ducts, we mean tubes. So epididymis, we have the vas deferens, we have the seminal vesicle, we have the prostate, and all these have their contribution to reproduction. So if one has a problem amongst these 5 or 6 components that I mentioned, then there will be a problem. Because I chose to take it gradually. So when somebody has an infertility problem, it's not just about the testes. Testes is just one of those. So, and then we have environmental factors, we have other factors around that. But I need to say this before we move on. People shouldn't be afraid. Rather, an advocate of comprehensive healthcare checkup. Because with the comprehensive healthcare checkups, even right from being a baby, there should be a comprehensive healthcare checkup where things are assessed properly. One of the problems we have with testicles is that it is possible that while a child is growing up, the testes may not descend properly. And there's a way it has been designed by God. It's such that the testes must descend because the temperature of the human body will not allow for sperm production. Like the temperature is it will denature the proteins necessary from sperm production. So the testes must come out, it must descend. So we have children where either both testes didn't descend properly, which means that they have become infertile even before they mature, grow. So that's about that. I deliberately wrote down some things because it's a big game today. So let's talk about the females. I don't dwell too much on the females. Coming to the different problems I share with part of it. The females, we have 5 major components. We have the ovaries. People know about that very well. Normally, a woman should have 2. That's what they call eggs. And from your introduction, you said the ovary would determine which sperm cell will. So the ovaries are important. It is in ovaries that we have production of the eggs. We call it eggs. We call it another egg. Then we have the fallopian tube. Fallopian tube, it's like an outstretched arm, and the arm, the hand part, is overlying the ovary, so that whenever there's a release of an egg, it goes through the fallopian tube into the uterus. Yes, it goes into it. So the fallopian tube is like a connecting door, so that the egg, it traps the egg. As egg is released, it traps it that this is where you should pass. Become useful. If you go elsewhere, you may not become useful. And there's an interesting thing about the egg, the human egg, that makes it very different from that of the male sperm production, is that the sperm production will continually, is a continuous process. So sperms are produced in a million every time. Whereas the eggs are released once per menstrual cycle. So the egg, one, is released per menstrual cycle. So we can understand the intricate balance of of this for the women. That's for the egg. Then we have the fallopian tube. Then we have the uterus. Uterus is a muscular sac, and the way I see it, one of the functions of the uterus, or the major function, is to allow for fertilization and then implantation and development of the baby till maturity. That duration should be for about 40 weeks. People say 9 months, but we use weeks because weeks will give you a more accurate time. It's expected to be between 38 to like 41 completed weeks, but let's say 40 weeks, plus or minus. So that's for the uterus. Then we have the cervix and we have the vagina. So the cervix is an extension of the uterus. And the cervix has its own interesting function. The cervix, by its function, though it's serving as the mouth of the uterus, it also determines if there will be fertilization or not. If the uterus, by the different hormone system, balance or imbalance, menstrual system, and the likes, the cervix would determine if a sperm cell will enter the uterus or not. You know, it usually has a mucus plug, and that mucus plug is usually acidic, such that sperm cells will not be able to naturally pass. So, but whenever there's ovulation, you know, that is in every female's cycle, there's always a time that the ovary is released, which is the time, as it were, suitable for fertilization. It is at that time that the cervix condition will change to allow sperm cells to pass through. So you can see that aside from the structures, aside from the physiology and function of each organ, there's a delicate balance in timing. You get my, so one cannot say I can get pregnant anytime. And included in this delicate balance is that there are other factors that can affect the timing. Other factors can also affect the condition of either the eggs produced or the sperm cell produced, or even their production at all. And some of these conditions will be from in utero, that is, while they are yet in their mother's womb. There could be congenital problems and there could be natural problems along the way. So let's just go. So we have the ovaries for the female, we have the fallopian tubes, we have the uterus, we have the cervix, and then we have the vagina. Those are components of the female reproductive tract, as it were. So let me just keep this in. At this point, we can now come into the reproductive process. Now, the reproductive process, which is the main goal of the reproductive system, which is to procreate. That's the main goal of the process, to procreate, so that there will be, should I use the word sustenance of our species?
Perfect.
Sustenance of our species on the earth. That's the main goal of reproductive system. So let's now look at the process. Number one is that it starts from gamete production. Let me say gamete production, that is reproduction of the necessary cells, sperm cells and the ovaries. So we call this gamete production. They are gamete, male gamete, female gamete. We can call it male cell, female cell. You know, it's important. And this production itself, so many things can affect it. Hormones regulate it. These hormones are also subject to timing. Environmental factors can affect these hormones vis-a-vis the time they will be released. Drugs can affect the release of these hormones. Infections and disease conditions can affect the release of these hormones. So we can see that it's you can imagine why I said I tried to run away from topics because it's such a very vast topic indeed. So the gamete production is necessary. After the gamete production, the next most important step is the fertilization. That is how to bring the male gamete with the female gamete come together. And a lot of factors are also involved at that point. But basically, there must be adequate sexual intercourse, so which will also affect That in itself is another area. Somebody to studio shaking.
Okay, so we could need like how many weeks to extensively talk about?
Let's
just
let's just
continue.
keep moving.
Yes.
So then the fertilization. So that's about the fertilization. Talked about from intercourse. So it's not just about intercourse. Are the sperm cells produced properly? Are they okay? Are they healthy? You know, is the egg healthy? Is the sperm cell healthy? Do we have enough sperm cells? And the likes. Then the sperm cells, even if it is healthy, is it coming at an appropriate time that the cervix will be able to allow it to pass? Are you getting my point? Is the sperm cells need to now get through into the uterus? Then adequate timing, the ovary must have been released. The ovary must have been trapped by the membrane of the fallopian tube. The ovary must have passed successfully through the fallopian tube. Now, the timing is important. Timing is important at every stage, because if there's fertilization at the wrong place, there'll be a problem for the woman. Fertilization at the wrong, for example, ectopic gestation. Gestation just simply means pregnancy. Ectopic simply means outside the normal place. So the uterus is where God has designed for it. That's why the uterus is a muscular sac. Some muscles, you know, are there. So that once fertilization is done, then implantation is the next thing. Because the eggs, the zygote produced, when the two meet, we need nourishment, we need nutrition. So that's why they stick to the wall of the uterus, and then they grow from there. They form the placenta. And they give it. Now, if the fertilization occurs, let's assume that the egg does not move fast enough through the fallopian tube, and the sperm cell goes through the fallopian tube and meets the egg on the ovary. That means pregnancy will happen on the ovary. You know, that's the problem. Or if the egg is not moving fast enough, and the sperm cells meet it in the in the fallopian tube, it means pregnancy will happen in the fallopian tube. And we all know that the fallopian tube is a small tube. So as the zygote increases in size due to growth, it will rupture. It will tear off the fallopian tube. So when you hear things like ectopic pregnancy, that's what it simply means. That is, the pregnancy has come, but it's now in the wrong place. And the wrong place will not be able to sustain it most times, to cause damage. And that's why when there's an ectopic pregnancy, doctors have to run into it's an emergency. Because once it grows to a point, and the point is not created for it, just like you can assume if there's pregnancy on the ovary, that means the pregnancy is outside the uterus. Nothing can sustain it there. Though we have some wonders of the world, though. You know, but let's leave those wonders. Let's talk about normal. If the pregnancy is achieved inside the fallopian tube, just a matter of time, it will tear off the fallopian tube because it's growing, it's enlarging in size. But it will tear off, and the woman will bleed to death. And the pregnancy will die once the woman is dead. You know, so it has to be in the uterus. So you can see that the timing of the ovary, the timing of the release of the spermatozoa is important. The timing about when they meet is also important.
Okay, so let's begin to take the questions as we go. What happens in the case of this ectopic pregnancy? Is there a way doctors can remove, I don't know what word would be appropriate, but remove the pregnancy and implant it where it's supposed to be?
Well, number one is that we have a lot of advances in medical science, or in medical technology, or technology in science. So there are different things that can be done. However, many times, these women come in. You know, in this part of the world, because it's a global platform, but let me say this part of the world, West Africa, Nigeria, Southwest Nigeria, a lot of women believe that even when they are sure that pregnancy has been achieved, they will not go for antenatal until a certain number of weeks. It's just a belief on the streets. When it's on the street, it's everywhere. And I try to tell them, it's so you're smiling.
You're right.
It's so wrong. It's so wrong. The teaching is that in fact, ideally, before you get pregnant, you should have been visiting your doctor, because there's something called preconception care. where the woman must have been assessed and deemed fit for conception.
Oh,
Yeah.
I needed to go over that.
Now, the ideal is that before conception, it's not just about I've gotten pregnant, so I'm waiting till 12th week or 3rd month or 4th month. No, that's gross error. The ideal is that even before pregnancy, somebody is married and she and the husband have agreed, let's have a baby. From that time, the person should visit the hospital where she would be given preconception care, before conception care. And the goal of preconception care is to have the woman fit for pregnancy. If there are conditions that can affect their achieving pregnancy, those conditions are dealt with there. You know, so aside from, even if there are no problems, then you are sure that, okay, let's keep this woman fit to achieve pregnancy and to carry pregnancy to term. So preconception care is the ideal, so that once you now achieve pregnancy, then we move into antenatal care. Just it's a continuum, as it were. So, but what's on the street is that until you get 12th week, or 3rd month, 4th month, and when it is showing, you know, and these are wrong things, very wrong. So by that time, preconception care, I would have known if whatever problems are there, it would have been addressed. Preventive care would also have been administered. If the woman had to be, maybe we have to check her status, hepatitis status, all these things are assessed at PCV level, everything. So once pregnancy is achieved, the person should also get to the hospital. Pregnancy is achieved, we know your normal vital signs, we know everything in from prenatal care. So we'll keep monitoring, and if there is slight change that is not expected, we need to intervene on time. You get, but a lot of times people come in when the ectopic pregnancy has caused trouble. She's now pregnant, and a very common symptom is that they faint. You know, has a fainting spell. We call it a spell, fainting, or sometimes even bleeding PV. So there's a teaching that says that once you have a woman of reproductive age and the person goes unconscious, that's what people say faint, you have to check for pregnancy, because one of the commonest causes, and it's an emergency. So you can't say faints today, so I'm going to hospital tomorrow. The person may not be able to achieve that. That is, maybe may have died for them. So there are a lot of interventions that could be if the person comes on time. A lot of medical interventions, a lot of surgical interventions, either to place it properly or to end the pregnancy itself. It's an individualized care, really, and that's where medicine is today. We can't say this is what we will do. It depends on you, the circumstances, and the conditions around that time that will determine what procedure will be done. So that's about ectopic pregnancy, and it's an emergency. So after fertilization, we move into pregnancy. So pregnancy, antenatal care, the fertilized egg becomes zygote, must implant in the uterus. Now, the uterus itself, based on hormonal changes, would also have been prepared for pregnancy. The uterus is not always prepared for pregnancy. That is, the uterus will not always accept pregnancy. Part of preparation is that due to hormonal changes, the endometrium, which is the inner lining of the uterus, would have been greatly enriched. Let me use that word. Would have been thickened, made more succulent, increased blood supply, expecting that something is coming to come and eat.
Preparing a banquet, so to speak.
Preparing a banquet, so to speak. So makes it so conducive for implantation. So that egg plus the sperm that has fused together, we now rest on it and start to feed from it. So it forms the placenta and then the umbilical cord. So as the baby keeps growing, this now becomes more differentiated. You have the placenta, you have the uterus, the placenta, umbilical cord, then the baby. You know, so that's that. Then the childbirth. So I divided into the reproductive process, gamete production, fertilization, pregnancy, childbirth. When the baby is okay, after an average of 40 weeks, to be less than 40 weeks, 37 completed weeks, or 41 completed weeks. That's the range. But by the time it's 40 weeks, baby is mature enough. Then we have the uterus. You know, science is wonderful. God is just an interesting. When it's time, the uterus that has been accommodating, stretching to take baby, will start to contract to push out the baby. That it's time.
You're in a like overstayed.
Yes,
You've overstayed your welcome.
Come and go. Come and leave. So there are occasional. Initially, there will be occasional contractions here and there. We call it Braxton Hicks contraction. Just to me, it's like sensitizing both the baby and the mother. It's close to time. Oh, there's a Yoruba that says that if you are given a visitor the head of yam, or is it the head of yam or the lower part of yam, you are telling the visitor that it's time to go. So the contractors are just saying, okay,
quick notice.
Quick notice. I give you 2 more weeks to evict. And then a time really comes. The contraction becomes strong. Then the cervix will start to dilate. The cervix that have closed up all these wires, preventing the baby from dropping, will now start to relax. So you would have been hearing things like the dilation is 1 cm, the dilation is 2 cm.
Yes.
Yes. The cervix will dilate to accommodate the passage of the baby. Now, that in itself, that process is also a very intricately delicate process, because the passage of the baby, it depends on the position of the baby, the size and the weight of the baby, the condition of the uterus, the condition of the cervix. So many things are there. So the birth process is a very delicate process. Wow. Can I continue? Because
yes, sir.
So I've divided that into reproductive process, gamete production, fertilization, pregnancy, and childbirth. And each one is a whole topic that we can keep talking about. So even the childbirth, which is a very visible one, as it were, it shouldn't happen, but it does happen that things can happen during pregnancy, and that the mother has complications, or the baby has complications, or the womb has complications. A lot of this is due to a lot of factors. I've mentioned poor antenatal care. Even people themselves don't, to me, I think they don't take themselves seriously. They assume that things can happen. Yes, people can deliver, I understand, without much problem. But the one that will have problems,
you would never know.
But a lot of these cause problems are preventable. So people should go for antenatal on time. Go for antenatal care on time. In fact, I'm advocating using this part of the day. Preconception care is important. Very, very. It will prevent a lot of unwanted issues during pregnancy. There are conditions that could have been treated before the baby comes. But if it has not been addressed, then it will not be a problem during, it will be more of an issue during pregnancy, because you're now thinking, how should we handle it? And some will also affect the baby after delivery. So that's on that.
Doctor, I'll need to hold you on that. Isn't it such a blessing that Doctor is here today to talk about this reproductive organ? Well, we'll be taking a quick breather right now, but when we get back, Doctor is going to take it up from right here where he's living.
This iconic African presents the narrative of a man destined to exert an imperishable global influence in Western education. His was a story of a freeborn, captured and sold into slavery. He was born in Oshogun, a native Yoruba village near Iseyin in Okeogun axis of southwest Nigeria. Samuel Ajayi Crowther was the foundation student of Fora Bay College, Sierra Leone, the foremost university where the pioneer set of native Africans were educated. Samuel Ajayi Crowther's greatest contribution to humanity was his translation of the Holy Bible into the Yoruba language. The man who authored the Yoruba dictionary was also credited with the translation of English classic hymns into Yoruba and the Ekwere languages. Samuel Ajayi Crowther's private residence in Badagry, incidentally, The first story building in Nigeria is an archival museum dedicated to the memory of Africa's first bishop. Western Spring Television identifies Samuel Ajayi Crowther as a watershed character in history.
Well, thank you for joining us on this episode of Spring Clinic on Western Spring Television. Well, right back, we've been talking about the reproductive organs. In case you're just joining us, Dr. Ogungbemi is here to take us through what the reproductive organ is, and in its totality, what it does, what it's about. And we've been talking about, we've talked about conception as it is, and right now getting down to complications that could arise from that. It starts there, and then we are ready to move on.
Thank you very much. Yes, we are back. I think I would like to go into health conditions that can affect the reproductive. I say that because I actually put down some of these things so that
I won't leave any stone unturned.
Hormonal regulation of the reproductive. Now I mentioned hormones and the delicate balance. These are this timing. I think we should know. We really should know. We have the hypothalamus is in the brain. I won't wonder what does the brain have to do with sexual reproductive. There's a part of the brain called the hypothalamus and the pituitary. They're actually responsible for the overall control or regulation of this. So the hypothalamus will produce a hormone called gonadotropin releasing. That's like the father of the country. So the gonadotropin releasing hormone will now control an organ called the anterior pituitary gland. So the anterior pituitary gland will release FSH, follicle stimulating hormone, and luteinizing hormone. In medical books, we call it FSH and LH. So it is possible if anyone is given an investigation and see FSH, LH, you know that they are being tested, know the level of those hormones. Yeah, so gonadotropin releasing hormone will work on the anterior pituitary gland, which will release FSH and LH at different concentrations at different times. Now, these two hormones are important in the males and in the females. But there are other ones that are added. In the males, we have the testosterone. And the females, we have the estrogen and progesterone. Progesterone will become elevated during pregnancy. In fact, progesterone is like labeled the hormone of pregnancy. Progesterone will be what works to keep the environment
conducive for the baby.
We need to give you a we need to give you a but let me quickly go into different problems of this organ. Let's look at the male. Very common problem: erectile dysfunction. Erectile. I'll just talk about. It's a big topic, very big topic, and it is defined as the inability of a male to achieve or maintain, some say sustain, erection sufficient for sexual intercourse. So it could be a problem of achieving it or a problem of sustaining or maintaining it. And it must be sufficient for sexual intercourse. So, and it could be caused by so many. A very common cause is psychological. A stressed person, if he's not psychologically okay, there'll be issues with that. So, because we see this a lot, and by the time we investigate, we find out there's no problem. Just that you are not, just maybe your thoughts are somewhere else. So, cardiovascular diseases can cause it. Diabetes mellitus can cause it. Hormonal imbalances can cause it. Medications can cause it. Smoking can cause it. Alcohol consumption can cause it. Psychological problems can cause it. So people are free to choose, let me use that word jokingly, either one or many of these factors together. You could have someone that has a psychological problem you know, maybe stressed at work, and now has a cardiovascular problem, and is using medications that can affect. So the psychology can have a problem, the cardiovascular problem can cause it, and then the medication he or she uses. In fact, sometimes people come and tell you, oh, the drugs I've been using have not been allowing me to do this. So as family physicians, we address all this. Then we have problem with the prostate. People are so familiar with BPH, benign prostatic hyperplasia, prostatic cancer, but people are not familiar with prostatitis, inflammation due to bacterial infection of the prostate. It can also be a problem. So those three are there. We have testicular disorders. We have testicular cancer. We have varicose. Varicose is a very, I won't say common. These are problems that people don't pay attention to. You know, we all know varicose veins. So varicose veins could also be around the testes, and if they are there, the heat production will kill the sperm cell production in the testes. So it has to be addressed. That's why when we go for checkups, I tell people, checkup is not something you go to the lab to say, I want to do blood test. And you just say PC. No. In fact, let me just use the opportunity to say this. For a checkup, this one is free of charge, me to you and to everybody. For a checkup, you go to a qualified doctor, preferably family physician, because what you are going to deal with cuts across all organ systems, irrespective of age and gender. You get it. So you go to a family physician. I want a checkup. It's not that he will write tests for you. That's not the first. The first that you will sit down, you will talk. He will ask for your history. Your father, your grandfather, your great-great-grandfather. No problem. Your grandmother, like that, he will ask. He will ask about their uncles. He's trying to trace if there are genetic issues in your ancestral tree. That's one. After he has done that, he will now come to you. Are you having these problems, these challenges? If you have complaints, if you don't have complaints, he will ask for things. Now, those would have been guiding him or her in a direction. That's that. After he has done that, which we call clacking, you get it? He will also ask for psychosocial issues, psychological and social issues, marital problems, family dysfunction, what is happening. Because all this, you can see that because psychological problem can even cause ED. So psychology is important. He will ask for all these things. Then, from all these things he puts together, he will now examine. Part of the examination for a male, irrespective of age, are all these things. So if they say you need to, okay, you know, a lot of, oh God, examination must be thorough, head to toe. Just imagine head to toe, whatever head to toe means. Then investigation. These investigations are divided into two. One, the first one is that there are some baseline investigations. Then there are other ones that are subject to the person's age and the history that the doctor has gotten, which will define the risk factors for the person. So the doctor does that. So it's not like me and my friend, we went and it was different tests. Yes, it will be different because your histories are different, your experiences are different, your complaints are different, and age may also be different. So that's from me to you.
Thank you, doctor. Did you hear that?
So there could be testicular disorders. So the testis has to be examined to know that. Hydrocele is also there. It's common in children, you know, where there's fluid accumulation around the testis. Then we have infertility. Infertility could be caused by any of all these problems I've listed. It could be caused by different other problems, systemic problems, and specific problems to the organ system, that is the reproductive organ. We have things like low sperm count, poor sperm count, just name it. The reproductive system disorders for the female. Very common ones, we have this menorrhea. Many people know that painful menstruation is not normal, please. A lot of times people associate it with that is normal. It's not normal. The way the system of a human being is designed, there shouldn't be pain. When we breathe, there shouldn't be pain. When my heart is pumping, there shouldn't be pain. Maybe the only thing I share with pain will be delivery. Any other thing, it shouldn't be there. If there's pain in the head, headache is abnormal. Pain in the eyes is abnormal. You understand? So pain during menstruation is not normal. So there's also amenorrhea, no menstruation at all. You know, there's menorrhagia where there's excessive bleeding. These things have definitions, they have criteria. but because of time, I just have to run.
Rush over it.
Run. We have polycystic ovarian syndrome, also a very common matter, where you have a lot of cysts around the ovaries. Endometriosis is also there. How should I define endometriosis? Endometriosis is simply defined, or let me just put in a simple word. The inner lining of the endometrium, of the uterus, is the endometrium. To be in the inside of the uterus. When you now have it within the walls of the uterus or around the uterus or at other places, it's like now pockets of it all around. So it causes serious pain. Fibroids. Many women have fibroids, but asymptomatic. That is, does not cause trouble. It's only when sometimes many of it are just even incidental findings. That is, they are trying to look for something else and then we find it there. But some are symptomatic. Very common symptoms are pain and bleeding, and then sometimes infertility. But they themselves could also cause some other problems. But these are just common. So, fibroids, inflammatory pelvic infection, pelvic inflammatory disease. It's a major problem. That's a big topic on its own. It's a major, and these things can cause infertility. Ovarian cysts and then infertility. So all the things I've listed here, except maybe the first one I mentioned, the amenorrhea will also lead to infertility if you are not menstruating. So many of these things can cause infertility. So infertility is a big topic, very big one. There are a lot of things we call STIs, sexually transmitted infection. These things will also lead to infertility if not corrected on time. And I must say this, that if you have any symptom of STI, get correct CORRECT treatment on time. If not, the symptoms, if you treat it shabbily or from a quack or from a pharmacy store and you don't treat it well, and there are quite a number of them, and their treatments differ. So if you treat A as B or you treat B as A, the symptoms may stop, but the process may continue. And one of the common complications of poorly treated STI is what? Infertility. I don't know if I still have time.
Just about 3 minutes.
Okay, 3 minutes more. So if we have gonorrhea, HPV, human papillomavirus. I need to say this. Human papillomavirus, there's a vaccine for it now. And a lot of advocacy for women. Herpes simplex virus, HIV, AIDS are there. We have cancers, which I also need to say people should go for screenings on time. Things are preventable. Cervical cancer, ovarian cancer, breast cancer. Ovarian cancer, people should go for screening, and then vaccination. Vaccination against HPV prevents against cervical cancer, because HPV is a very common cause of cervical cancer. Breast cancer, there's a lot of screening. Women should check themselves regularly, and if you perceive that anything is wrong, go to your doctor on time. A good doctor, because we have a medical doctor. So I think with that, I may start to run. There are other matters anyway, but it's a good place to stop.
Well, it has been an amazing, time here. Hearing Doctor talk about the reproductive organ, lots of things. In fact, I think it's the one that we didn't really have so much time to really, handpick and talk. But my take home today, I don't know what your take home is, but my take home today is about getting pre-conception care. Pre-conception care, and the fact about treating all STIs correctly. Doctor said not all these STIs have different treatments, don't treat them. You cannot treat them the same. And he also emphasized you getting, a medical doctor, not a quack, in his words, medical doctor, not a quack, who knows what he's doing. Thank you, doctor, for your time today. It was really insightful, and we have a good take home. Please get preconception care. It's very important, so that every complication could be detected on time. Thank you very much for joining us today on this episode of Spring Clinic on Western Spring Television. My name is Temitope Ajijolaoluwa Ola. Looking forward to having you on the next episode.